We're just sorting the technology. Oh, here we go. We're all ready now. So hello and welcome to everyone to our Digital Infoday session. This webinar will be covering mainly side effects and symptoms of myeloma. We'll take you through some of the common issues faced by patients and offer some helpful and practical tips in dealing with these. The webinar is being recorded and it will be available for you to watch on our Facebook page and on our website soon after. If during the webinar you'd like to have a chat to each other, you can use the chat box. And if you have any questions for the speaker, please use our Q&A box at the bottom of your screen. So I'd like to introduce myself now. My name's Kim and I'm one of the Myeloma Information Specialists here at Myeloma UK, working alongside my wonderful colleagues Ellen and Sarah. Part of our role is to offer support and information, and we often take telephone calls and respond to emails as patients and family members get in touch with us. So please do contact us anytime if you have any worries or questions, or just need to have a chat and share your feelings and thoughts out loud with someone. We're just at the end of the line there. For those of you who are new to Myeloma UK, excuse me, our organisation supports anyone who's affected by myeloma or an associated condition, such as MGUS, smouldering myeloma or asymptomatic myeloma, and AL amyloidosis. Our work is always patient focused, and we aim to empower and inform and support patients in everything that we do. Myeloma UK receives no core government funding, and as an organisation, we, like many other charities, rely on the generosity and kindness of our supporters, fundraising and donating. So all of your support is vital, and we are truly thankful for all the contributions we receive. Every penny counts and really contributes to making a difference, allowing us to continue working to help patients, their family and their friends. So now I'd like to welcome this evening's expert, Millie Blake-McCoy. Millie is a Haemato-Oncology clinical nurse specialist at North Middlesex Hospital. Millie has over 16 years experience in haematology, first in Birmingham before moving to London to work at the Royal Free. In 2009, she joined the haematology team at the North Middlesex as clinical nurse specialist, where she developed the Haemato-Oncology Clinical Nurse Specialist Service. Millicent also offers professional support and develops education for nurses working on the chemotherapy day unit and the Haemato-Oncology ward. Millie has also supported the London Myeloma Support Group and with the help of her colleagues has started a haematology support group at the hospital. In addition, and as a result of Millie's hard work and commitment, the myeloma service at the North Middlesex University Hospital has now been presented with the Myeloma UK Clinical Service Excellence Programme Award, which recognises when superior care is given to myeloma patients through best practice initiatives and provision of optimum standards in myeloma treatment. So thank you for joining us this evening, Millie, and for sharing your expertise on managing symptoms and side effects. I'll hand over to you now to start our presentation.
Thank you very much, Kim, and thanks to Myeloma UK for asking me this afternoon to do this talk. It's a privilege, and I'm so happy to be a part of your team. This talk will cover causes of fatigue, mind or memory problems, and pain in myeloma. We'll also look at tips for managing with these symptoms and the side effects. Symptoms and side effects in myeloma, some of them fatigue, pain, mind and memory problems are all common symptoms in myeloma. They all interact and affect each other, so management is the key. Interactivity of the symptoms can affect each other. For example, pain and fatigue can affect your cognitive function. And if you struggle to remember things, that can affect you more and make you more fatigued. So living with the symptoms and side effects can be exhausting, and other people might not realize what you're coping with. So it's very important to let others know how you're feeling. Now we look at what is fatigue. Fatigue is an overwhelming and persistent tiredness, a tiredness that you feel sometimes not satisfied by sleep. You may have reduced energy levels, memory or concentration, sex drive, and or appetite. You can also feel weak or lethargic and feel dizzy or disorientated. Almost all myeloma patients will experience it at one time or another, and many struggle most with fatigue after treatment after treatment is finished, when they think that everything should be back to normal. And as the picture depicts on this slide, showing an half-filled battery, some patients will describe it as running on an empty battery. Others would say it feel like walking through treacle. What are the causes of fatigue? And as it shows, myeloma and the treatment factors are causes of fatigue. Direct side effects of treatment, example, thalidomide, and the other derivatives of thalidomide, such as pomalidomide, lenalidomide, and some painkillers. Pain is also another cause of fatigue. And as we know, one of the commonest problem for myeloma patients are bone pain and neuropathic pain, which we'll talk about a little bit later. Anemia is also another side effect of fatigue. And anemia is when your red cell count is low. Infection also causes fatigue, and kidney problems when your kidney is sluggish. Lifestyle and emotional factors involve poor diet and nutrition, difficulty sleeping, reduced activity levels, emotional impact of having myeloma. These can be draining and increase your level of fatigue. So how do we manage these symptoms? How do we manage fatigue? Identifying the causes of your fatigue is the first cause, or causes of fatigue is the first step in treating and managing it. So for your anemia, as I mentioned before, you have a low red cell count, and your red cell is what contains hemoglobin, which carries oxygen around your body. And when that is low, you feel really tired and lethargic, as I said before. So blood transfusion, we give you back some red cell to boost your energy level. Also, some patients feel a boost of energy level after blood transfusion. And also EPO injection, which we do once a week. And as you know, EPO is a hormone that is produced by the kidney, and it stimulates the body to produce the red cells that you need. Having pain relief also helps with fatigue, because when you're in pain, it makes you tired, as we mentioned before. Complementary therapies, and it's good to use renowned therapies and let them know that you have myeloma when you go for complementary therapies. Kidney problems, so if you increase your fluid intake, I always say to patients, when you have kidney problems, keep drinking. We advise 2 to 3 liters per day to keep your kidneys functioning, because myeloma, one of the side effects of myeloma is, as you know, is kidney problems. Infection, we'll talk more on this later. And your myeloma treatment can be adjusted to help reduce the fatigue that you have. So sometimes the doctors will reduce your lenalidomide or any other treatment that affects you with fatigue. Living with fatigue. And as the pictures depict, eat well. We recommend that you eat a balanced diet, which includes your fruits, your vegetables, and your carbohydrates, and all the other energy food that you need to function effectively and to reduce your fatigue. You can also, if you find that you can't tolerate 3 meals per day, it's advisable that you have little and often. Little snacks, cheese, whether it be biscuit, whether it be full fat yogurt, whatever you feel for, you should have it. Drink plenty of fluids, keep yourself hydrated, and you can have your carbohydrates, which increase your energy levels, and your vitamins, which helps with your immune system. So it's very important to eat well. Rest. Listen to your body. Whether it means you could sit or lie down for short naps. It's good to have a set bedtime each day. Hot baths, and adding lavender or warm showers, having a hot drink before bed, and avoid caffeine and alcohol near to your bedtime. Gentle exercise also help to relieve your fatigue. And you do what suits you, whether it be walking, swimming, whatever makes you comfortable. You don't need to overexert yourself or overdo it. Time your treatments according to their effects. For example, your dexamethasone, you take them in the morning because it prevents you sleeping at night. Also, you take lenalidomide, thalidomide, and your pomalidomide nearer to your bedtime. The 3 Ps to help with your fatigue. Plan to do things when you're feeling at your best. Plan downtime for when you need it. Prioritize. Do the things you have to do first. Think about what really matters to you and what works towards doing work towards doing that. I'm really sorry here. So anything that matters to you that you need doing, think about it, prioritize, and work towards doing that. Also, listen to your body. Pace yourself, go at your own pace. Try not to overdo it. When you feel well, build up little by little. Do little by little at a time. These are tips from other patients who are living with fatigue. One patient said, I can't manage the housework in one go, but if I do a little bit each day, resting in between, I'm happy with that. Another patient said, every time the fatigue came on, I would get up and do something, mostly go for walks. So again, it's doing what suits you and what works best for you without overexerting yourself. Now we look at mind and memory problems. What are mind and memory problems? Mind and memory problems are common side effects of myeloma treatment. In particular, chemotherapy and steroids can cause side effects that alter your cognitive function, sometimes known as chemo brain and dex days. They can be worse by or occur as a result of other side effects of fatigue and pain. So let's look at the chemo brain. General fogginess, feeling out of sorts, struggling to remember your words, usually due to the side effects of treatment. Fatigue, infection, stress, and anxiety can make things worse. And the dreaded Dex days. Steroids like dexamethasone can cause some troublesome neuropsychiatric side effects. Irritability, psychosis, mania, euphoria, agitation, you get panic, you have mood swings, anxiety, insomnia, depression, distractibility, delirium, and memory loss, just to name a few. Steroid and Dex can affect your mood swings and increase your energy. Sometimes you feel an increased energy with steroids. Managing mind and memory problems. How do we manage these? We must report side effects promptly to our doctor or nurse, and doses can be lowered and or the frequency can be adjusted to support you. Try relaxation, meditation, or visualization techniques. Take your dexamethasone in the morning to reduce the insomnia. And another way, you and your partner may want to sleep in separate beds if this is possible and if this is affecting you. Living with mind and memory problems. Rest well. Write down important details, use Post-its, a notebook, or a notice board. Put everything in a calendar or a wall calendar. Set alarms and reminders on your smartphone. Nowadays you have smartphones and iPads. Try gentle exercise, go walking. The fresh air sometimes refreshes your brain and just give you a boost. Take time in the evening to reflect and process on your day and process the day. What have you done? What helped you throughout the day? And that sometimes helps with your mind and memory problems. Patients' tips for mind and memory problems. Other patients try to prepare for your Dex days. Take a long walk to tire yourself out. Have a paper to read or program to watch is if you're awake and can't go back to sleep. Another patient said, I've decided the best plan was to stop apologizing for my unusual behavior. Move on and understand it's just part of the reaction to the drugs. So these are other ways that other patients cope and is encouraging you to use. Now we go on to complementary therapies. These are used in addition to your myeloma treatment, not alternative therapy. Aims to help you cope with myeloma, with your myeloma, and it can be helpful for reducing fatigue. And it's available for your carers too. So it's good to talk to your nurse or your doctor and get to know the local, what is there in your hospital and in your local cancer centers. For some centers, there's a cost and facilities will vary. So, and especially during lockdown now, it's good to find out what is available. And there are many different options, including aromatherapy, massages, yoga, Tai Chi, reflexology, and importantly, the therapeutic touch.
Sorry, I've just realised I was muted. Apologies. So we'll start again. So I was saying, thank you very much, Millie. That's been really interesting and informative, and it's got our evening off to a great start to get some information and tips about managing fatigue and mind memory problems. So we come to the first of our question and answer sessions, and thank you to everyone in the audience who's submitted the questions. We'll try to get through as many as we can. So our first question comes from Marion, Millie, and she asks, what tips do you have on how to cope with diarrhea whilst on treatment?
Thanks, Kim. That's a very good question. As we know, one of the general side effects of chemotherapy is diarrhea. Also, medications like lenalidomide, some patients get diarrhea with those treatments. And the main thing is, because if you find yourself having diarrhea more than 3 or 4, up to 3 to 4 times daily, you need to report it to your team and your nurse. There are special tests that they'll do at first. So I know some patients would ask, can I go out and just buy Imodium? No. Please get to your team. They will do the test. They need to check, is it an infection? Is it related to my treatment? So there are special tests that we do. And for treatment like lenalidomide, there are other treatment that you can get to help with that. So the main thing is to let your team know.
Absolutely. That's really good and useful advice. A lot of patients do feel quite embarrassed, don't they, about those sorts of things, but it's really important. Your healthcare teams are really familiar with those kinds of symptoms. So absolutely letting them know is so important. That's absolutely spot on. I'd agree entirely with that, Millie.
Yeah, thank you.
Okay, so another question that we've had from Jackie, and she says that during treatment she's put some weight on, and she asks if you can suggest any exercises that will help reduce this, or if there's any particular foods she should avoid.
Okay, another good question. Steroids can cause increased weight, and we know steroid is one of the main treatments of myeloma as well. So you need to tell your clinician again, you need to let your doctor and your nurse know, because they can help by reducing the dose of your steroids. And also for the second part of your question, asking can you suggest any exercise? It would be good to be referred to the physio so they can guide you to what some exercises that you can do that will make you feel that you'll be comfortable with. In terms of dieting, when patients are on treatment, we tend to say, do not diet, because you need all the energy to help you to fight your condition and to work with your chemotherapy as well. And so the best thing is to ask for a dietitian referral, and your dietitian can guide you on some of the foods that you can have, because we know there are complex carbohydrates like bread, wholemeal, high fiber food that can help you, but the specialist is the best person to advise you, because like dairy is high in fat, and you can choose a low option. Also, healthy diet, we'd say, consists of more fat from fish, nuts, olive oil, and those are the polyunsaturated fats. But the best person to help with that is the dietitian.
Yeah, I'd echo that, Millie, too. I think as well, sometimes patients, it's very difficult if you are putting on weight. But sometimes that can affect how you feel about yourself, can't it? So sometimes talking to your nurse, or maybe asking for a referral to counselling, where you can just think your thoughts out loud with somebody that's not connected. And sometimes patients can find that helpful. So yeah, absolutely. That's, one of the things that, is really difficult for patients sometimes in terms of body image, isn't it? So And I guess, exercise as well, even things like gardening and, even doing the ironing is a form of exercise. So, it doesn't have to be high impact, long distance kind of things. And obviously patients need to be careful of their bones as well. So, being referred to the physio, talking to your nurse can really help you decide what you might need, what might be helpful for you to consider, kind of thing. So another question that we've had is, which is quite a difficult one to answer, and lots of patients often ask about it, is how long will fatigue last for?
Yeah, that is, I would say, first, unknown. We don't know, because each individual is very different, and fatigue impacts on each person differently. And as we as mentioned in the previous slide, that some patients, after treatment is finished, when they said, okay, I expect everything to be normal again, I won't feel, that's when their fatigue will kick in. So each individual is different. So I would recommend gentle exercise, as we mentioned, eating well, drinking fluids, and remember the 3 P's: pace, prioritize, and plan your days. And don't overdo it, little at a time. And don't, sorry, I said that, don't overdo things. Yes.
Yeah. It is so difficult, because I think there's an expectation, isn't there, that, when you're on your treatment, your levels are improving and you think you should be feeling better, and often you don't feel as well as you expect yourself to. So that's sometimes difficult, but certainly talking to your nurse it is really important, so that they're aware of how you feel. So yeah, absolutely. Another question that we've had from Neville, he's been in touch, and he says he's having problems sleeping, particularly on the days that he has his Velcade and dexamethasone, and he's asking if there's anything that he can do that can help him sleep on those particular days. I know we've touched on it a little bit, but I just wondered if you had anything else to add to that.
Yeah, this is a common problem with most patients who are on treatment on dexamethasone. It does affect their sleep, and it's a similar thing. As we say, have your dexamethasone in the morning. I always say to patients, try and have it before 12, and as the other patient suggests in the slide before, tire yourself out, have warm baths, and some patients find hot milky drink before bed sometimes help. And also speaking to your doctor and your nurse, you can reduce the dose of your dexamethasone and also reduce the frequency as well. And that sometimes helps.
Yeah, absolutely. Yeah, that's great. And sometimes even trying some relaxation tools and techniques before you go to bed, that can sometimes be useful. So the complementary therapies, and finding out about what you might find useful to try, it might be worth a go. So, definitely. So we'll carry on with, we've had some really good questions from our audience, and thank you so much for sending them in. And Millie, you've given some excellent advice and support there. But we're going to move on to the second part of our presentation now. And this is where we're going to look at pain and its management. So I'll hand things back to Millie now so that we can continue with the webinar.
Okay, so looking at pain, this is two patients' feedback. My pain is constant and unrelenting. It gives me a feeling of isolation that no one apart from me and my husband understand. It's a daily battle to keep focused. And another patient described his or her pain as a constant daily grind, limiting me physically at work and in social terms. You learn to cope, but it's hard it's hard for other people to really understand what you feel. And most of you may relate to some of these feedback that other patients go through. And it's so important, as the last patient say, to let others around you know how you feel. So what are the causes of pain in myeloma? The main causes of pain in myeloma are bone disease and peripheral neuropathy. So, and we know bone disease is very common to myeloma, and because we know the myeloma within the bones affect the bones because of this the protein which cause the bones, the bone marrow, in the protein in the bone marrow, which cause the bones to it changes the working of the bone, because on a normal basis our bones build up and replenish itself, but myeloma causes the bones to break down. So that's where, and it thins, and patients get pain from that. Peripheral neuropathy is another cause of pain in myeloma. Also infection, mucositis, constipation, and bone marrow test. So pain, how do we manage the pain? So pain is often relieved by treatment of myeloma itself. So once you start chemotherapy, your pain, in most cases, patients say their pain changes. And many different types of painkillers are available. So you need to ask, if the one that you're using doesn't work, you should ask for a different one. And there are different methods of administration of painkiller. You can get it in tablets, you can get it in patches, injections, and nasal sprays. Specific painkillers can be used for different types of pain, especially for neuropathy. And radiotherapy also used to reduce the myeloma cells in the bones and also decrease your pain. And there are surgical options for vertebral compression, which, and your team will decide which is more suitable for you. What is peripheral neuropathy? Peripheral neuropathy can occur as a result of myeloma and its treatment, particularly bortezomib, Velcade, and the main side effects is sharp burning or jabbing pain, pins and needles, altered sensation, increased sensitivity to touch, and numbness. And that is why that's one of the main questions that we'll ask you. And you find, oh, why does my doctor always ask me, do I feel pins and needles or any pain or tingling? And that is because we need to know, because we know that's one of the side effects of bortezomib. And how do we manage this? So we need to, one of the things is to change your dose. We change your dose of your treatment, and sometimes we have to pause treatment. And because it's so important, because it gets worse before it gets better. So it's very important to tell your clinician as soon as possible, because that's how we can relieve it quickly. So specific neuropathic drugs are available, such as amitriptyline, gabapentin, or carbamazepine. Some of you may be on it. Quinine, you can have some people have the quinine sulfate, or they sometimes get the quinine. Sorry, the drink has gone from my head. There's a drink that you can get that helps with it, as opposed if you don't want the tablet. And you can have local anesthetic injection or patches and TENS.
Tonic water. Is that
Tonic
what you meant?
water. Thank you, Kim. Yes, because sometimes some patients doesn't want the tablet. They said, okay, too many tablets, and they try the tonic water, and it works for them. Yeah, thank you. Living with peripheral neuropathy, massages can help. Capsicum or menthol creams, hot water bottles, ice pack, so you can have the hot and the cold, and well-fitting protective shoes. And also your vitamin supplements may help, like vitamin B, but you need to speak to your doctor or your nurse first, because that is important, so whatever you take doesn't interact with your treatment.
And sometimes patients find that if they've got that either a burning pain, then sometimes the cooler creams can help. But if it's a cold type of pain, then the warming creams can help. So, getting some advice from your nurse is really helpful in those cases, isn't it? Yeah, I bet you get lots of people ask you.
Yes, you do. And also, some patients will just say to me, oh, at night, my feet burn so much. I'll put the cover on, I'll put the cover off. And when you find you have those symptoms start to come, you know there's something going wrong. Please tell your nurse or your doctor that that is happening. Yeah. Living with pain, be honest about your pain, about the pain you have, and ask for help when you need it. Take painkillers as prescribed. It's better to keep on top of it rather than waiting until your pain is bad enough for painkillers. And many times I have to say this because, as I mentioned before, some patients do not like to take the tablets, but it makes you better. It gives you a better quality of life. And when your pain is so intense, one of the things you remember is that high pain that you feel. And it's best to control it before, because it takes longer to control when you don't take your pain relief on time. So I would encourage that, because I've seen it happen. And that's the only way forward to help you with that. Try distraction and relaxation tactics. Complementary therapies may help again, such as the massages, reflexology. I know some patients use that to help with their pain. So it is what works for you. And it's better to get on top of it sooner than later. Palliative care team. The palliative care team are symptom control experts, and they work with the hematology team to manage your pain and control some of the symptoms and side effects of myeloma. So I know it's daunting when your consultant or your nurse may mention the palliative care team, but this is very important to know that they do other things than the end of life care. They're there for every step of your treatment and care. And I feel that getting to know them sooner when you have a problem is also very good, because as your problem increases and you have that liaison person in your community, that is very helpful for you, because you have someone to call at any time. You can also be referred to the team to help with your pain management as well, in other words. I'm sorry. Patient tips for living with pain. Get a really comfortable mattress if you're suffering from back and rib pain. Try orthotic insoles to relieve peripheral neuropathy. Also seek support from as many places as possible. Hospice outpatient teams can be very helpful. Also open up opportunities for complementary therapies. And as I mentioned before, it's very good to know your local hospices, because they have several outpatients and wellbeing centers nowadays that can support you with all the symptoms and side effects that you get from treatment. keep a diary. Keep a note of your side effects to show your healthcare team. Useful things to note: when you're most tired, in pain, or foggy. And that is very good in relating to your treatment. At what state of my treatment do I feel like this? Any exercise that you do, your daily activities, how well you slept, what you've tried to alleviate your problems, what makes it better, what makes it feel worse. And these are good ways to go forward for your team to help with your care. Communicating with your healthcare team. It's vital to communicate the effect of side effects on your life. It can sometimes be underestimated or missed when in your appointment. Your healthcare team will find ways to help, changing the dose or trying new treatment or giving you supportive treatments. You might not want to say anything because you're afraid that your treatment will stop, but there are plenty of other options to try first. And this is very important to let them know on time. Yeah. Key points to remember. Do not underestimate the side effects on you. Living with fatigue, pain, and other side effects can be extremely difficult. One of the common things I hear my patients say, oh, it's old age. And I would say, tell your healthcare team about any side effects. Keeping a log diary can be really helpful. Also, ask for a referral to the palliative care team. They are there to support you with symptom control throughout your treatment, not just for end of life. Tell your family and friends so you're not suffering alone. They can help. And just having someone there sometimes makes a difference. Just discussing it with someone makes so much a difference. They are there to help. Supportive treatments, complementary therapies, and self-management techniques can really help. Speak to other patients about what works for them. As you see the tips that other patients gave on the previous slides, it may be a case of trial and error to find something that works for you. So that's why it's very good to get as much support as possible.
That was so useful, Millie. I think lots of patients find it difficult, to talk to people because they're worried that things that might make things change or the treatment plan change. So, it's so important. Everything is relative to you as a patient. Yeah. So, you can't, there's no comparison. It's not worse or better than somebody else might be experiencing. So it's really, really important, like you say, to let somebody know, even, if it's your nurse, your doctor, your family, us on the info line, just get in touch and we can offer you some support with how you're feeling.
Yeah.
So we've got some more questions that have come through just now. So I'll just ask some questions there. Just bear with me. I've just got them here. Okay, so yeah, we actually had a patient that asked us about they've got a history of psychosis and they needed to have steroid treatment, and what they were asking about was if we could perhaps give some details about the potential impact of that steroid use and what they should do if they find that they're not feeling able to cope. So I just wondered if you haven't had any thoughts about that, Millie.
Yeah, as we know, steroid is a very important part of the treatment, and it helps because the 3-drug is better than the 2. 3 drugs are better than 2 in managing your myeloma. And the main thing is that for your team to know about the history of your psychosis. Are you seeing anyone? Are you having any treatment? What treatment are you on? That's very important to let your consultant know. What I've seen in my experience is that for patients that fit in this category, that has the same problem as you do, they start with a lower dose of the steroids and you're monitored closely. So I think it's a balance of working closely with your consultant and because everyone's history is very different. And you start with a reduced dose, and also they may change the dexamethasone. There are days when you have less of the dex, and it limits the frequency as well of your dexamethasone. And also there are parts of the treatment when it can be omitted. So it's how you are with the treatment as well. So for you, I'm getting that this is a history, but you're worried about the steroids. So I think trying it with your consultant, and each consultant will work very different in managing that. And the potential impact, as we said before, it can cause you to increase your agitation. It can make you irritable. It can also exacerbate your psychosis as well. So you can expect anything. It's very open how you will be with it, but it's an area that we have to manage very closely. I don't know if that answers your question.
Yeah, I think as well, if somebody's feeling that they're not able to cope, or it's having an impact on them, psychologically and emotionally, maybe talking to their nurse and asking about whether a referral to counselling might be appropriate. That also might be useful, mightn't it? I guess so. So yeah. So another question in relation to steroids. It's a hot topic, isn't it? Steroids. We've had a member of the audience has contacted us and asked us about the main side effect of his treatment has been cataracts in his eyes caused by the steroids, and he's just wondering whether this will be something that will be an ongoing side effect, or will it stop when his treatment finishes? Any thoughts?
So yes, so steroids again, yes, can affect your eyes in any way. Some patients get blurred vision, they get cataract. And it's very important to ask your team to refer you to the ophthalmologist in this case. There's no, for if you already have cataract with treatment, it will not go when you finish your treatment. Hopefully it will not worsen. But the best support that you can get is from the ophthalmologist in that case.
Yeah, so that's going to be something that's going to be quite useful, isn't it? I think, and I think it's just, again, not ignoring the symptoms that you might notice. Anything that's new or different, or is problematic, or is just bothersome, always let somebody know, because it may be something, it may be nothing, but you can get some reassurances about it, can't you? So, absolutely. So another question that we've had in from the audience, not steroid based this time. Someone's asked that they've said that they're going to be having a stem cell transplant soon, but they're really, really worried about mucositis. So they're just wondering what you might suggest to help with that.
Yeah. Pre-stem cell transplant, you'll meet with a specialist nurse a stem cell transplant specialist nurse, and they will go through some of what they have available. But we know some patients will have ice lollies in their mouth. I remember the days when I used to do to infuse the stem cells. Patients would sit there with their ice lollies because what they feel, that coldness will help to protect, because mucositis is the inflammation of the lining of the mouth, and it can go down down the GI tract. So I can understand your concern on that. So ice lollies, and one of the things we recommend as well is using a baby toothbrush during those days after transplant. It's very soft. It will do the cleaning, but it's very soft. And there are mouthwashes, and those are always prescribed ahead of you starting transplant. If you get dry mouth, there's artificial salivas that the doctors can prescribe, as well as pain relief, because it can be painful. And one of the key things with the stem cell transplant, the daily mouth assessment. And this is reported back to your team, and and they can act on things early when it comes to mucositis.
Yeah, some really good and useful tips there, I think. So, you know, though my mouth was watering when you were talking about the ice lollies, Millie, I have to say. So we've had another question in from the audience who's asked, it's relating to peripheral neuropathy, and they're just asking, is it reversible? Can it be reduced? I know we touched on it a little earlier, didn't we? But
yeah, so peripheral neuropathy, as we spoke about earlier, is the nerves that are outside of the central nervous system. So it's the nerves in the arms, in the legs, your face. So you get that tingle, and some patients, it may affect their gait, how they walk. So those patients are referred to the physiotherapist to help with that. The main thing and the message, I would say, report this to your doctor and your nurse early. Peripheral neuropathy gets worse before it gets better. So in some cases, we have to stop the treatment to help with the healing of that, to treat your peripheral neuropathy. And then we restart when you start to feel better. Is it reversible? Yes. I've seen patients who had really bad peripheral neuropathy, and so in my experience, they were able to recover with treatment. So effective pain relief and reducing your treatment, reporting the changes that you have. And another thing I would say, it's very individual. So you might not go back to your original baseline, but you do get better with peripheral neuropathy.
yeah, it's always a difficult one, isn't it? Peripheral neuropathy. I think it affects everybody very differently. But
Yeah.
the important thing is to report it as soon as you notice something different, so that somebody can do something about it to help.
Yeah.
So really important, absolutely.
Yeah.
So we've just got time for one more question here, and we've had a question in from Kirsten at this time. And she's saying that she's finding that her pain relief is making her feel totally out of it. But without it, she's in a lot of pain. So she's just wondering what she should do. You know, she says she finds the side effects from all the medications that she's prescribed actually outweighs the benefits. What are your thoughts about that?
For Kirsty, should need to be with the pain team in that case. So we mentioned the palliative care team. They are good pain specialists, and they work with patients, and they, as you said, you go through a lot of treatments there. They work with you to find the right one for you, because as you know, some pain relief affect the kidneys, they know what to do, whether you get a patch, whether you get the nasal spray, whether you get one that has less effect, as you say, you're out of it. So there are loads of pain relief that they work with and work with you to get a balance. The main thing is to find a balance, find one that works for you. So I'd say ask your team to refer you to the specialist pain team, whether it be the palliative care team or the local pain team, to help with that, because I'm sure there are pain relief that you can have that doesn't let you feel so much out of it when you're having it. Because if your pain is not controlled, if you're all out of it with pain relief, then it affects your quality of life. So it's very important that you have support with that.
Absolutely, yeah. And I think, sometimes it does take a bit of trial and error and patience as well, doesn't it? But reporting anything that you find that's very different, or if you're finding that you're being affected in ways that you're not expecting, always let your team know, because they'll be able to offer you some help and support and refer you to the right team to help manage those things, most definitely. So I'm really sorry that that's all we've got time for in terms of questions today. But I'd just like to highlight some of the resources that we've got from Myeloma UK that you might find helpful. So as Millie's mentioned, keeping track of your symptoms and when they're happening, it's really useful to do that, because it's not always easy to remember everything, is it? So actually using the patient diary helps to keep everything in one place, and just helps you to recall the things that have been going on for you. So that's a really useful thing, and lots of patients find it helpful. The info pack for living well with myeloma has some really useful tips on some of the chapters in there, certainly with exercise, diet, and lots of other things that can be helpful when you're affected by the side effects and things with myeloma. We've also got some publications relating to fatigue, pain, and peripheral neuropathy, which can be, there's some useful hints and tips in there, so they're worth a read. At the moment, we obviously can't send publications out, but hopefully that time will come back soon. But you can look at them on the website, and you can download them to read them on there, so that they may be worth having a look at, just to give you a bit more information. So in addition to all of those things that we, to those publications, you can always call our Myeloma UK info line. We're open between 9 to 5, Monday to Friday, and you can share anything at all with us. The calls have no length, so you can speak for as long as you need to, and you can talk to us about anything that's bothering you at all, whether it's a symptom, whether it's a question, or whether it's just that you're feeling a bit fed up today. You can always give us a call, and sometimes that can help, and we can offer you some support and information about what to do next, really. So that please don't ever hesitate. No question is silly, and no symptom, all symptoms are relative to you, so they're always important to report. We've got a number of myeloma support groups across the UK. Unfortunately, as at the moment, because of the nature of our environment, we're not meeting face to face, but a lot of them are meeting virtually. So if you want to know more information about that, please just get in touch with us, ring the info line, and we can give you some more information about that. We've obviously got lots of patient information publications, and lots of patients find that really useful. It's written in a very clear and accessible way, so that it helps you to understand what's going on. And again, you can find copies of those on the website. We can normally post them out, but and that will return as soon as we're back in the office on a regular basis. Our patient and family info days and digital sessions are a really good way to bring information together. We normally face to face, but obviously we can't do that at the moment, but those days will return, and hopefully we'll be able to continue with that. It's always good to meet other people and talk to other people who have similar situations, so that's something that can be really useful. So our 3 take-home messages really are that myeloma and its treatment can cause a variety of side effects and complications, and those things can interact with each other. So it's important to let somebody know if you notice anything that's new, different or problematic at any time. Fatigue, pain, mind and memory problems, are also very common, and myeloma can affect myeloma can have a large impact on day-to-day life. So those particular symptoms, can absolutely reverse what you're familiar with, because you're having to experience and live with those things, and your team are there to help and support you as much as they can. So please do talk to them, and as always, you can give us a call on the info line too, or drop us an email. There are ways to manage them, but it's vital that you get that support and help. So we've come to the end of our webinar now, everybody. So thank you so much for joining us, and thank you to Millie for joining us and sharing your expertise with us. Also to the people behind the scenes as well, without who we couldn't, run these events. So finally, thank you to everyone in the audience who's joined us, and that's the end of our webinar for this evening. So we hope you found it helpful and informative, and please keep an eye on the website to find out when further ones are happening in the future. Take care, everyone. Nice to see you all. Good night.
Right.